The presenters in this presentation are Emilita, Alexandra, Emily, Misty, Andrew, and myself, Beckie. Our topic is the measles. Morbidity refers to the number of people who are infected by measles. Prior to the creation of the vaccine, which was created in 1963, the Centers for Disease Control and Prevention claims that approximately 3 to 4 million people in the United States were infected by the disease annually. In 2013, there were 187 cases reported in the United States. Mortality is best defined as the number of deaths in a given population. It was reported that prior to the vaccine, about 400 to 500 people died from the outbreak. When looking at the disease globally, in the year 2015, 134,200 deaths were reported. Fortunately, the number of deaths due to the measles has recently decreased by 75% throughout the world, going from 544,000 deaths in the year 2000 to 146,000 deaths in 2013. Incident rate refers to any new cases of measles in a given period of time. The incidence rate of measles varied anywhere from 21 cases to over 600 new cases from the year 2010 to the most present year 2017. Though the outbreaks have decreased drastically due to the vaccination, measles still affects people in the developing countries such as Africa and Asia who lack access to the measles vaccine and healthcare. Of the many outbreaks that have occurred, the most recent outbreak occurred between December 2014 to February 2015. It was reported that there was a total of 125 cases in the United States involving measles. 39 of the 125 cases noted that they had been to Disneyland in California between the 17th and the 20th of December. 34 of the cases were due to secondary exposures, meaning they had come to contact with someone with the virus. Though the initial source of the exposure has yet to be known, it is assumed that the disease could have come from an international visitor who was at Disneyland, given that the theme parks attract tourists from all over the world and that there are countries where measles is still prevalent. The graph shows the number of confirmed measles cases and settings of transmissions from the start of the outbreak in California during December 2014 to April 2015. As you can see, from December 28th to about January 11th, most of the cases were due to being exposed to measles at Disneyland, as indicated in blue. The purple indicates an unknown source of the disease. Green indicates community contact to a case of measles, and red indicates household or close contact of a case of the disease.
Measles, also known as rubella, is a severely communicable disease caused by a virus that affects the respiratory system. So the agent of the disease for measles is through a virus. Here is a picture of what the measles virus looks like. So here we're going to talk about the signs and symptoms. The measles virus typically originates in the naropharynx and causes its host to experience symptoms such as high fever, runny nose, chronic coughing, red eyes, sore throat, and a rash starting at the head and extending down to the hands. The most distinctive symptom for healthcare professionals is usually the rash. The rash usually consists of tiny red dots as shown on the picture off to the right. And as stated before, it starts at the head and can go all the way down the torso and down to the hands, but it could also be inside the mouth. And when this happens, usually there is a really high fever. Here we're going to talk about the mode of transmission. The measles is highly contagious because of its mode of transmission. It is airborne. The virus can survive up to 2 hours in the air or on objects. That is why it was so alarming when the recent measles outbreak happened at Disneyland, California. So the virus usually lives in the nose and throat mucus of an infected person. And when this person coughs or sneezes, large respiratory droplets are released from them and out into the air. Over here is a picture of a person sneezing and the droplets that are filling up the air. So if this person was affected with the measles, potentially it could spread within 2 hours before it dies.
There are many different mechanisms used to control measles. The first type is primary prevention to reduce occurrence of the disease. The primary prevention used to control the spread of measles virus is that children have to be vaccinated twice with measles, mumps, and rubella vaccine. At the age of 12 months and 4 years old, the children have to be vaccinated. Another main mechanism that help individuals prevent the spread of disease is through good hygiene. Examples of good hygiene would include washing hands, not sharing foods or utensils, but the best primary mechanism would be vaccination. Next is secondary prevention to reduce progress of the disease, and if any individual has symptoms such as a fever, cough, runny nose, red, watery eyes, or if a rash breaks out with spots, the individual should visit a doctor for further guidance and help. Lastly, tertiary prevention is designed to limit the disease, and if any individual has the measles virus, the individual needs to be isolated to prevent for further spread of the disease. Therefore, the patient needs to be vaccinated with measles, mumps, and rubella vaccine to prevent from further spread. Also, individuals need to be vaccinated before helping a person who is infected with measles and have a clean and disinfected the environment to prevent others from receiving measles virus. There is no treatment but vitamin A and over-the-counter drugs for fever reducers are recommended and help reduce symptoms of the measles infection. These following steps will decrease measles virus and will make the patient healthy again. Measles is so contagious that if one person has it, 90% of the people close to the person who are not immune will also be infected. The host factors that make the vitamin vulnerable is the immune system. The viruses live within the mucus of the nose and throat. Measles virus is the most contagious disease compared to other diseases because it spreads through the air by coughing or sneezing, infecting the air for at least 2 hours. Individuals who have close contact with people who have measles are most likely to obtain it because measles virus is spread through breathing in the contaminated air and touching the eye or mouth and after touching infected surfaces. Children and adults can receive the measles virus, but unvaccinated young children, pregnant women, or any non-immune people are most at risk.
Hi, my name is Andrew Steininger, and today I'm going to talk to you about the environmental and temporal variables related to the measles virus. Firstly, the measles virus is influenced by geographic location. It's less common in industrialized nations due to the availability of the MMR vaccine, which prevents it, but it's still common in some countries in Africa, Europe, Asia, and the Pacific. That brings us to the difference between epidemic and endemic. In Africa, Europe, Asia, and the Pacific, the virus is still endemic, meaning it's habitually present in these populations. In the United States, however, we don't really see local transmission of the disease, so anytime it's locally transmitted, we call it an epidemic, meaning it's clearly in excess of normal expectancy. Another environmental variable related to the measles virus is socioeconomic status. Low-income conditions tend to favor transmission of the measles virus because people of low income tend to live in more crowded quarters and also have malnutrition present in that population. Living in crowded quarters is a huge problem with the measles virus because of how the disease is spread and how contagious it is. People living in crowded areas are more likely to see higher rates of disease transmission because it's airborne and droplet transmitted. Here's a graph showing how the measles virus has declined over time. You can see that once the measles vaccine was licensed and started being distributed, immediately rates started to fall. And now you can see any time that there's a locally transmitted case in the United States, why we'd refer to it as an epidemic, because it's above normal expectancy, which is virtually zero. Next, I'm going to talk about the temporal variation of the measles virus. We tend to see higher disease rates with the measles virus during the late winter and early spring seasons, or in tropical climates in the period following the rainy season. One theory explaining the seasonal variation of the measles virus is that it has to do with host behavior. Because it's a childhood virus, It's more likely to be spread during school time because children spread it to one another at their schools. So during the summer, we tend to see a lot lower rates of measles transmission. Here's another graph depicting the seasonality of the measles virus among school children. You can see when school's not in session, transmission of the measles virus drops significantly. And this data is from two different years, one in 1929 and another in 2000, and you can see the same result. And that's all I have regarding the environmental and temporal variables, so thank you very much for listening.
Hi, my name is Misty Soto, and I will be talking about other epidemiological variables. To start off, an important fact to know about measles is that there are no known animal reservoirs. Measles is also a highly contagious disease and can lead to other complications with onset of infection. These include ear infections and diarrhea. Ear infections occur in about 1 out of every 10 children with measles and can result in permanent hearing loss. Diarrhea is reported in less than 1 out of 10 people with measles. Other complications are subacute sclerosing panencephalitis, acute encephalitis, and death. Death from measles was reported in approximately 0.2% of the cases in the United States from 1995 through 1992, mainly coming from pneumonia, which accounts for about 60% deaths. Subacute sclerosing panencephalitis has problems within itself. These are long-term complications, which include fatal disease of the central nervous system, and will develop 7 to 10 years after a person has measles. It is also more likely to contract this if the person is under the age of 2 when contracting measles. Another thing to note is that it is dangerous for children to contract measles. For every 1,000 children who gets measles, 1 or 2 will die from it. If a woman is pregnant, there are also concerns. If the mother has contracted measles, the fetus is at higher risk of premature labor, spontaneous abortion, and low birth weight infants. The current hypothesis for measles is that it has the potential to be eradicated from Earth. We have all the resources and medicines to do so, but we need to enhance education, especially with myths about vaccines itself, and have more people vaccinate themselves and their children, along with having accessibility to the vaccines.
Hi, my name is Emilita Bonilla, and today I will be discussing the gaps in knowledge, suggestions for further research, and conclusion related to the measles virus. One gap in knowledge surrounds the topic of vaccinations. The 52 cases of measles that originated at Disneyland was an extreme wake-up call for those who didn't understand how vaccines work. The vast majority of the infected individuals were unvaccinated, and only 6 were vaccinated who acquired the disease. According to the CDC, the vaccine is 97% effective and is one of the most effective vaccines in the world. However, very few people, about 3 out of 100, who get the 2 doses of measles vaccine will still get measles if exposed to the virus. Experts are not sure why this happens, but that it could be that their immune systems didn't respond as well as they should have to the vaccine. This brings us to the topic of herd immunity, which is the resistance to the spread of a contagious disease within a population that results if a sufficiently high proportion of individuals are immune to the disease, especially through vaccination. If more people opt to not get vaccinated due to various reasons, including religious reasons or the fear the vaccine will have harmful effects based on discredited studies, this will create more chances of the virus to spread rapidly. This first chart shows the outcomes of certain barriers for people not getting the vaccine, and we can see that the weighted 79.8% of patients or parents consider that measles is a harmless disease, and 50% fear that vaccination has side effects. This second graph shows a timeline from 2000 to 2014 and the huge increase that happened in 2014 of confirmed measles cases when the vaccines were at a decline. According to the CDC, vaccine exemptions tend to cluster geographically, making some communities at greater risk for outbreaks. Further research could include considering strengthening the difficulty of the application process to be opted out of receiving the vaccine, and also have substantial healthcare practices like discussing in depth with hesitant parents about vaccinations to educate them. Provider outreach and public education about vaccines should be a high priority to help eliminate measles altogether. The measles virus is far from being eradicated and remains a deadly hazard for many. A lack of access to the vaccination or not wanting to have the vaccination is what makes this disease a continued health risk. Measles deserves the $100 million for distribution and application of the vaccination in third world countries where the virus remains prominent. With enough funding, thousands of lives can be saved.
Thank you for watching.
Brought to you in part by